Insulin resistance and glucose intolerance are interrelated conditions, often mentioned in the context of metabolic disorders and linked closely to the development of type 2 diabetes. Insulin resistance is characterized by the body's inability to respond adequately to insulin, a hormone that helps regulate blood sugar levels, while glucose intolerance refers to the impaired ability of the body to process glucose, leading to higher than normal blood sugar levels, particularly after meals. Symptoms may be subtle or nonspecific, but can include increased thirst, frequent urination, fatigue, and in some cases, blurred vision. Treatment strategies often involve lifestyle modifications such as diet changes, increased physical activity, weight loss, and sometimes medication to improve insulin sensitivity or glucose metabolism. Factors such as obesity, a sedentary lifestyle, and a family history of diabetes can increase the risk of developing insulin resistance and glucose intolerance. Here's a comprehensive outline of both conditions to better understand their implications and management. Onset of condition, insulin signaling defect versus cellular glucose uptake issue. Insulin resistance and glucose intolerance represent two sides of the metabolic dysfunction coin, primarily featuring in the pathology of type 2 diabetes mellitus. Insulin resistance is characterized by the body's inability to respond to the hormone insulin, leading to defective insulin signaling. The pancreas compensates by secreting more insulin, but over time, this can lead to pancreatic burnout. In contrast, glucose intolerance manifests as the impaired ability of cells to uptake and utilize glucose effectively, even when insulin signaling may still function adequately. This condition may present without overt signs of insulin resistance. Pinpointing where a patient falls on this spectrum is crucial for a tailored treatment approach, ranging from dietary interventions to medications that either sensitize the body to insulin or directly aid in glucose uptake and metabolism. Understanding the onset of these conditions could provide early indicators for intervention and potentially halt the progression towards full-blown diabetes. Primary physiological process: reduced insulin efficacy versus impaired glucose utilization. Insulin resistance and glucose intolerance are facets of the same coin, that coin being the body's ability to manage blood sugar levels. In insulin resistance, the body's cells become less responsive to insulin, the hormone that facilitates glucose uptake from the bloodstream into cells. The pancreas compensates by producing more insulin, but over time this can lead to pancreatic burnout. Glucose intolerance, on the other hand, is characterized by the body's inability to efficiently handle glucose following a meal, leading to elevated blood sugar levels. Prolonged periods of glucose intolerance may be a precursor to type 2 diabetes, a condition marked by chronic hyperglycemia. Understanding these processes is crucial in differentiating the root cause of dysglycemia and tailoring effective interventions. Response to insulin: insensitivity to normal levels versus normal sensitivity, but poor handling. Insulin resistance and glucose intolerance are precursors to type 2 diabetes, showcasing a dysfunctional relationship between insulin and blood sugar regulation. With insulin resistance, the body's cells become less responsive to the hormone, even when levels are normal, essentially ignoring the insulin key, trying to unlock the door to absorb glucose for energy. Consequently, the pancreas is burdened to pump out more insulin in a compensatory effort. In contrast, glucose intolerance reflects the body's inability to effectively process glucose, despite a normal reaction to insulin, akin to a correct key struggling in a jammed lock, leading to elevated blood sugar levels following consumption. Identifying which issue is at play is crucial in tailoring interventions, whether it means enhancing insulin sensitivity or improving glucose uptake and processing. Typical progression: progressive metabolic dysfunction versus immediate post-prandial aberration. Insulin resistance and glucose intolerance, often intertwined in metabolic disorders, manifest differently. Insulin resistance typically denotes a condition where cells in muscles, fat, and liver start to repel insulin's effects, necessitating greater amounts of insulin to maintain glucose levels. This is a progressive dysfunction that worsens over time, often culminating in type 2 diabetes. Contrastingly, glucose intolerance primarily refers to an acute inability to process sugars effectively right after eating, resulting in immediate spikes in blood glucose levels. While it can lead to chronic issues, the hallmark of glucose intolerance is its post-prandial, post-meal nature, revealing a more direct impairment in handling dietary glucose. Both conditions flag potential paths toward diabetes, but differ in their temporal onset and progression. Associated conditions: metabolic syndrome versus prediabetes. Insulin resistance and glucose intolerance are key factors in the spectrum of metabolic dysfunction that can foreshadow more severe conditions like metabolic syndrome and prediabetes. Metabolic syndrome, a cluster of conditions including increased blood pressure, high blood sugar levels, excessive body fat around the waist, and abnormal cholesterol levels, increases the risk of heart disease, stroke, and diabetes. Prediabetes, characterized by slightly elevated blood glucose levels that are not high enough to be classified as diabetes, is often underlined by both insulin resistance and glucose intolerance. While individuals with insulin resistance struggle to process insulin efficiently, leading to high blood insulin levels, those with glucose intolerance have difficulty maintaining normal blood glucose levels, particularly after meals. Both conditions are heralds of the body's diminishing ability to manage glucose, marking critical intervention points to prevent the progression to type 2 diabetes or cardiovascular diseases. Addressing lifestyle factors such as diet, exercise, and weight management is instrumental in mitigating these conditions.